My name is Grace Nottingham, and my speech is about the importance of vaccines. The World Health Organization estimates that 2 to 3 million lives are saved annually due to vaccines. Vaccinations are a necessity, and decreasing popularity of them is becoming dangerous, and it's putting many lives at stake. First, I want to explain to you how vaccines work. Vaccines have many ingredients in them, and some people can be wary of them, but none of them are actually dangerous. Adjuvants simply help boost your body's immune system. So as soon as that vaccine goes into you, your immune system is already fighting back against it. Stabilizers and preservatives help make sure that the vaccine is effective after the manufacturing process. It can be kind of lengthy, so the people that make it just want to make sure that once it gets to its destination, it still works how it's supposed to. Formaldehyde inactivates toxins during the manufacturing process. Not only is it a naturally occurring substance in your body, but any amount of it that's left over in the vaccine after manufacturing is perfectly safe. Antibiotics are similar. They prevent contamination during the manufacturing process, and they also are a naturally occurring substance, and any residual amounts are perfectly safe. Vaccines work by introducing a very small amount of a virus to your immune system. Your body then learns how to fight back against it. It's kind of like a training exercise for your body. This is important because your immune system has a very good memory, and it can remember any number of things that you've been vaccinated against. The immune system comes into play in the subject of prevention also. Even if you come into contact with a certain bacteria years after being vaccinated against it, your immune system can still remember how to get rid of it and will instantly start fighting back against it as soon as you're exposed. A great example of this is the human papillovirus, or HPV vaccine, which targets types of HPV that can later cause cervical cancer in people. According to the Mayo Clinic, it's administered in children ages 11 to 12, and it can be effective for up to decades of prevention. Understanding how vaccines work is an important step towards understanding why they are a necessity. An important thing to keep in mind when deciding whether or not to vaccinate is that they aren't just for the people getting them, they're for everyone around that person. There are several reasons why people can't be vaccinated and why they may not be able to receive a certain immunization. Some of these are religion, age, pregnancy, allergies, and other pre-existing conditions that could leave them immunocompromised, such as chemotherapy or organ donation or transplant. This being said, it's important to vaccinate yourself in order to keep the defenseless people around you keep themselves healthy too. Herd immunity occurs when a high percentage of the community is immune to a disease, making the spread of the disease from person to person very unlikely. Even individuals who aren't able to be vaccinated are offered some protection because the disease has very little opportunity to spread. This definition of herd immunity comes from the Association for Professionals in Infection Control and Epidemiology. This graphic is a really good explanation of how herd immunity works. If you were to take a community where blue means unvaccinated, yellow means vaccinated, and red is infected. So if you take one where no one is vaccinated and insert even a couple of infected people in there, almost the entire community is going to end up getting it because they have no protection against it. If you take a community that has a handful of immunized people and that are mostly still unvaccinated and put those infected people in there, you'll still end up with almost all of your community being infected, and the only people that are helped are those that are immunized against it. The last one is the best example of herd immunity. You have almost everybody in the community being vaccinated, and then a few that aren't vaccinated, probably because they aren't able to. You put a couple of infected people in there, and there's virtually no way for the disease to spread because there's no way for it to travel from person to person if everyone is immunized against it. The invention of vaccines is arguably one of the most important creations in modern medicine. Thanks to vaccines, diseases like diphtheria, polio, and smallpox have been completely eradicated and have saved millions of lives. These vaccines were so effective because the vast majority of people were immunized, which prevented further spreading. Unfortunately, in the last few decades, the popularity of vaccines has greatly decreased, which is leading to the rise of diseases that had almost been completely gotten rid of in the past. Unfortunately, many people fear vaccines because they don't have a full understanding of how they work. A lot of people could be scared of the idea of purposefully infecting themselves with a virus, and they take side effects as signs of being sick. However, this actually isn't the case at all. Side effects like soreness and mild fever is actually just your immune system's way of fighting back against the virus and getting rid of it. Another common misconception is that receiving multiple vaccines can overload your immune system, but according to the World Health Organization and multiple studies, that is not the case at all. One of the biggest misconceptions that people have is that vaccines can cause health problems or even lead to the development of mental issues. This stemmed from a doctor named Andrew Wakefield, who in 1998 wrote and published a paper that supposedly showed evidence that vaccines could lead to autism in children. Word of this quickly spread throughout the medical community, and people were understandably shocked. But soon after, it was discovered that the entire study was completely falsified and none of the information was true. Despite this, many people who don't support vaccinations still use this as a claim as to not vaccinating themselves and their children. In conclusion, the fear and taboo against immunization mostly stems from people not understanding how it really works and why it's effective. The benefits and advantages of immunization are clear, and they must be normalized and encouraged in order to prevent future problems. Vaccinations aren't just for individual health, they're a way to prevent and protect everyone around you.